And welcome to Washington Unplugged. Bob Schieffer here. Well, the Senate Majority Leader Harry Reid announced yesterday that the health care reform plan he will send to the Senate floor for debate will include the so-called public option. In other words, a government-run health insurance plan similar to the Medicare plan for older Americans. But it will include a provision that will allow each state to decide if they want to opt out of the plan. The question now, does he have the 60 votes he needs to begin the Senate debate? We're going to talk this morning with the top Republican budget man in the Senate, New Hampshire Republican Judd Gregg, who had some harsh words for Senator Reid yesterday. And then we'll talk to Democratic Senator Ron Wyden of Oregon. He's on the Finance Committee. He also has his own proposal for health care reform. After that, we're going to report on Bill Cosby, who was in town last night, and Washington Unplugged tracked him down. But first, here's Senator Gregg from the Capitol. Senator, does Senator Reid have the 60 votes that he needs to get this to the Senate floor and to begin debate on this legislation?
I really don't know the answer to that question. As I understand it, he and Senator McConnell, the Republican leader, are talking about a very open floor activity where there'll be basically unlimited debate and offering of amendments with lots of debate. If that's the format under which he brings it to the floor, then I think that's fine with us. That's the way we want the bill to proceed. It'll take a while, but it's a big bill. It's the most important bill I've ever seen come across the floor of the Senate, or will see, and therefore it should take a while to do, probably 5 to 6, 7 weeks. But as long as it's the classic Senate approach, which is everybody gets to put their 2 cents in through an amendment process and gets a fair chance at amending it and fair debate on the amendments, then let's go and talk about the issue.
Well, as I understand it right now, I don't know a single Republican who favors the public option, and I know there's some moderate Democrats that have real problems with it, which makes me wonder, can he get the 60 votes he needs to even start the debate on this? You seem to think that perhaps he can?
Yeah, I think if he and Senator McConnell reach an agreement as to how the debate should proceed, there's no question he can get the 60 votes to start the debate, because we won't filibuster going to the bill as long as we get fair treatment on the floor relative to the way the bill proceeds. He'll probably have a lot of trouble getting it off the floor because there aren't going to be many people who are going to vote on our side of the aisle. I don't think, hopefully there won't be any, who would vote for a nationalized system or a government plan. And as a result, he would have to get 60 votes on his side of the aisle to close debate and get to a final vote.
All right, let me just ask you a basic question, Senator. The Senate will or will not decide whether or not to start this up. What is wrong with a public option? Why are all the Republicans against it? And you know, there's 5 or 6 moderate Democrats I know at this point that they say they're not sure about it either. What's wrong with it?
Well, it basically limits the ability of people to choose their health care. It fundamentally undermines the quality of health care in that it really damps down and chills innovation. And it leads inevitably. The only way a public option, a government plan, nationalized system saves money is if it controls prices. And when you start to control prices, whether it's drugs or whether it's your doctor's reimbursement or whether it's your hospital reimbursement, you naturally lead to some delays in health care or to rationing like they have in England. Single-payer systems inevitably lead to a lesser quality of health care and a significant reduction in people's choices, and people will inevitably lose their private insurance. A lot of people will, because the government will crowd out of private insurance because it's very hard to compete with the government when the government's setting prices.
But if someone does want private insurance, they'd still be free to buy it, would they not?
Well, it would be unlikely. In many instances that would be the case because it wouldn't be available. Look at it this way. Under the plan as it came out of the Labor Committee, which I serve on, the Health Labor Committee, basically they set a fine for an employer, which was fairly low in its charge, if the employer decides to drop your insurance and push you into a public plan. Well, most employers are going to look at this in a very cold way. They're going to say, do I save money by paying the fines versus buying insurance? And most of them are going to say yes. So therefore, they're going to drop their insurance and push people into the public plan. And the public plan inevitably leads to a lower quality of health care, in my opinion. I mean, all you got to do is look at England and Canada to see that your health quality is very significantly impacted when you have a nationalized system, because it chills innovation. It significantly retards innovation, and on top of that, it ends up limiting your choices, and you end up with significant delays, and at least in England, you have ration.
Do you believe, Senator, obviously people in the upper income groups are going to have to pay higher taxes to pay for some of this. Do you believe in the end that it'll mean higher taxes for everybody?
Yeah, well, it's either going to mean higher debt for our children or higher taxes for a lot of people. You've got a plan here which is basically scored at $827 billion, the present plan out of finance, but that was only 5 to 6 years. The income was scored over 10 years, but the full institution of the plan was over 5 or 6 years. In other words, there was a phase-in. When the plan is fully phased in, my staff on the Budget Committee tells me that this plan will cost about $1.6 to $1.8 trillion. And the revenues, even if you accept the fact that they're going to cut Medicare by $400 billion, which I doubt, and use it for this new entitlement, or that they're going to increase fees and taxes by $500 billion, which they may, even if you accept those numbers, you still have a huge gap between what a fully implemented plan costs and what the revenues are and what the rate of growth reductions in Medicare are. And so that gap is either going to have to be filled by significant increases in taxes on everyone, or alternatively by throwing it on the debt. And right now we've got too much debt as it is, you know. Debt is a huge problem for us as a country right now.
Just a few seconds left, but let me just ask you to be a prognosticator. Do you think that some sort of health care reform is going to pass this year, or do you think we may wind up with nothing?
Oh, I'm absolutely sure something's going to pass. The president's put his entire presidency on the line on this issue, and the Democratic Party, which has got a supermajority in both houses, has the ability to do pretty much what they want. Of course, if you want to pass a good health care plan, you'd pass what your next guest is going to talk about, Senator Wyden. I'm a co-sponsor of his bill. There are ways to do this in a bipartisan manner, which could be constructive to the health care system, but putting in a public plan is not one of the ways to do it. That would be destructive to our healthcare system, and a lot of people would lose their present health care, and I think in the end you'd lessen the quality of health care throughout the country.
All right. Judd Gregg from New Hampshire. Thank you very much,
Appreciate
Senator.
you.
And now we turn to Senator Ron Wyden, Democrat, who joins us from the same location in the rotunda of the Russell Building, one of the offices for senators up on Capitol Hill. Well, Senator Wyden, I want to start with the plan that you have offered because Judd Gregg just paid you a very good compliment. He said he's going to co-sponsor your bill. Your bill, as I understand it, allows people to choose the insurance plan that they want, not necessarily the one they get from their employer. They can basically cash that in, find a plan that is more to their liking, and then it takes the place of what they have. Does that have any chance in this coming debate?
Bob, what we're trying to do is export some of the principles of our legislation, it's called the Healthy Americans Act, to the bill that's going to the floor. For example, the president continually says, and I agree with him, you ought to be able to keep the coverage you have. And certainly a lot of folks think that's political security, is telling people they can keep what they have. What I've been saying, though, is if you hate what you have, if your insurance company is abusing you, you ought to be able to have other choices in the marketplace, what's called the exchange. And I'm telling you, it isn't going to be political security for members of the United States Senate to tether people, to force them to say with stuff they don't like.
All right, well, let's get to the legislation at hand. Do you, at this point, Senator Wyden, believe that the Majority Leader, Harry Reid, has the 60 votes he needs to start a debate on this legislation?
Bob, I was very encouraged with what Senator Gregg just said in the earlier part of the program. Senator Gregg indicated that if there was a free-swinging debate on the floor of the United States Senate, and Senator Reid has already indicated that's what he favors, he thought we'd be able to proceed to the bill. Look, we're dealing with a sixth of the American economy. Medical costs are just gobbling up everything in sight. So the challenge, as far as I'm concerned, Bob, is creating a new marketplace where everybody can have choice and competition. For example, yesterday, I thought Harry Reid made the right decision to put the public option back into the mix, but the Congressional Budget Office has actually told us that 7 years after this bill is enacted, less than 10% of the population would have choice in terms of their coverage. Private choices, public choices, any kind of choice. Now, you're not going to be able to hold the insurance companies accountable if less than 10% of the population has choice. So we've got a lot of work to do on the floor.
So what is going to happen next, do you think? Do you think there is going to be, in the end, a public option to this, or are the votes simply not there in the Senate?
I think there will be a version of the public option in the final bill. It'll probably be an amalgam, Bob, of all of these approaches that are being discussed. But I think the issue to watch is what happens to premiums. Because I can tell you back home when I'm having town meetings, folks don't come up to me and say, Ron, let's talk about the budget office or some other Washington issue. They want to know what's going to happen in terms of their premiums. And I can tell you that the Finance Committee legislation says, for example, that somebody making $66,000 could be paying something like 19% of their income on health care when you take their premiums and their co-pays and out-of-deductible expenses and their deductible expenses and all of the out-of-pocket that they have to absorb. I can tell you folks in America aren't going to say that's an affordable premium to pay 19% of your income on health care.
What about this idea that Senator Reid is now advancing that's going to be in this bill, that each state can opt out of this plan? What exactly does that mean? How does it work? Does the governor decide they don't want to participate? Will the legislatures have to decide whether or not they participate? And how will that affect health insurance overall?
The details, of course, are still being worked out, and what Senator Reid is trying to do is be responsive to the states. What may work in one state won't work in another. My concern about this goes back to the premium issue, Bob. If you want to hold premiums down, you've got to get folks into the biggest possible groups that you can. Members of Congress belong to the Federal Employee Health Benefit Plan. I belong to a group there with 1 million people. So if you just fragment your risk pools and set up all these opt-out arrangements, it's tougher to hold down premiums. So I'm going to watch that issue, because to me, everything is going to come back to making sure that you have the largest possible groups. That means you'll have low administrative costs, have a big group to spread the risk through, and that's how you hold down premiums.
When do you think that this will finally, when were we going to know whether or not some kind of health reform passes? Do you think it's going to be by the end of this year? Will it be next year?
I think we could be looking at Christmas Eve. The Wyden twins are almost 2, and we're telling them their Hanukkah presents are going to get to them, but it's going to be a pretty rollicking end of the year.
All right. Well, thank you very much, Senator Wyden. Always a pleasure.
Thank you, Bob.
Finally today, our Lauren Schieffer and Walt Cronkite caught up with America's funny man Bill Cosby last night. He was at the Kennedy Center with some famous friends to receive the Mark Twain Prize for Humor. Here's their report.
Weather's warm, no rain. Got plenty of stars out tonight. I have my wife, this is my daughter, and we're having a wonderful time. And it's supposed to be about me, but you can hear that they're cheering some other people, so I just feel lost. Our young people are killing each other. How much longer do we wait to speak up and see what we can do about stopping that? My education, my acceptance of education, my acceptance that this is a great, great time to study, this is a great, great time to know as much as I can, and then put it on paper in a cockeyed sort of manner. Mr. Seinfeld's coming, I want to move on.
I don't think this award even begins to acknowledge his contribution to, hey, I can straighten my tie in your camera, in American comedy. I mean, I think he's the greatest American comedian that has ever lived, so I'm honored just that I'm here participating in this. You know, comedians are always looking for new areas to talk about, and he just always shows me that you can talk about anything.
You know, he was out there in front, on the front lines for years and years, doing such good work that there's really no telling how popular he really is or how much impact he's really had, but a whole lot, I know that.
Mr. Cosby saved a network, and he also presented one of the most truthful and positive images of America to the entire world.
there's so much that he's done that just people don't know, just in terms of, you know, the tons of people he's actually sent to school and actually paid their education for, the money that he's actually donated to schools. He's been, you know, very much on the forefront of the importance of education without all the fanfare.
He's written me a lot of checks to not tell jokes about him. No, Bill Cosby is about as good as it gets. He's the best comedian I've ever seen. He's the best comedian working today. If you went to see him right now, you wouldn't believe how funny he is.
He is the embodiment of spontaneity, and you have to keep up. And it was so much fun keeping up.
What a night it was. Well, that's it for Washington Unplugged today. Join us here every day at 12:30 at cbsnews.com. I'm Bob Schieffer. Have a great day.